So, hi everyone, good afternoon. Thanks for joining this session. So, at the very onset, we would like to wish you a very happy new year, a very healthy new year. And today, Dr. Aparna will be discussing about winters and the health effect, winters and heart health. So today Dr. Aparna will be taking some questions. We have some questions lined up for her. So you can also shoot your questions in the comment section. We will try to answer your questions at our best. So with this, I would like to invite Dr. Aparna Jaswal to just start with the session.
Good afternoon to all of you, and I wish you all a very happy new year. At the outset, I would like to tell you that this new year we must pledge to stay safe, and we have to ensure that we continue to follow COVID appropriate behavior. Omicron is around, COVID is very much around. We must do everything to protect ourselves, and this goes without saying. Do not go out if you don't need to. Make sure you are well masked. Make sure you wash your hands very well. Make sure you maintain adequate distance when you are around people. So from here, we're going to start the session, and I think Jaya and I have been trying to come back to you over and over with things which are dealing with our lives in day to day. So today we thought we would speak of winter and heart disease. It's important we touch this subject because we are seeing as cardiologists every winter there is an increase in the amount of admissions in cardiac units. So I think we'll take up some questions from here. So Jaya has some questions which have been forwarded to her by some of you listeners. So we'll take it off and let's start, Jaya.
So ma'am, the very first question I would like to ask you is how winter season can affect your health in various ways.
Yeah, so I think that's a very pertinent question. The first question is, how does winter affect our health? So at the very outset, I think let's begin with what we see on ourselves. I think as soon as there is winter, we realize the first thing that we can see is the dryness of our skin. It is well known that winter makes our skin dry. Similarly, with the onset of winter, we drink less of fluids. Now this has a very high impact. It is well known that if we take less fluids in our system, it has significant impacts on our heart, on our blood, on our urinary tract. So it is important to ensure that you keep yourself well hydrated. And of course, the next thing, which is in fact the most important, is the impact of winter on our heart. So this is something which we are going to discuss today, winter and heart. And I'm sure some of the viewers who are here with us will realize that with the onset of winter, they have had an increase in their blood pressures. So I think let's start from there and let's listen to what the questions are.
So ma'am, the question is, why do winters make our heart vulnerable?
Yeah, so I think she says, why does winter make our heart vulnerable? So as I just mentioned, the first thing that winters does, cold weather. What does cold weather do to our bodies? As soon as it becomes cold, our blood vessels constrict. When our blood vessels constrict of our entire body, it results in an increase in the heart rate and it results in an increase in the blood pressure. So these two result in our heart beating stronger. Our heart has to beat harder. So whenever there is cold weather outside, it causes our blood vessels constriction. Because of the constriction of our blood vessels, our blood pressure increases. We are well aware that a rise in blood pressure has a significant impact not only on our heart but also on our brain. Just as a high blood pressure makes us vulnerable to heart attacks, a high blood pressure also makes us vulnerable to having brain strokes. So with the onset of winter, you must make sure that you have your blood pressure checked. If your blood pressure is high, you must seek medical advice. You must try to do everything to keep your blood pressure under check. When I say blood pressure under check, we mean that your blood pressure should remain less than 140/80 at all times of the day. People often come and ask us, what time of the blood pressure should I measure? Well, your blood pressure should remain well under control all round the clock. So any time of the day that you measure your blood pressure, it should be less than 140/80. But it is important to measure your blood pressure after you are well seated, you have not had a coffee, you've gone to the washroom, you've seated for about 10 to 15 minutes, then measure your blood pressure. So these are certain pointers which make our heart vulnerable. High heart rate, high blood pressure, heart having to beat stronger and harder, and during winter, there is increased coagulation in our blood system. The clotting factors increase. All of this makes a perfect milieu for our heart to become vulnerable.
Right, ma'am. Thank you for the information. Another question is like, is it really so that heart disease increase in winter, or is it really like heart attacks happen more in winters?
Yeah, so the question is, do heart attacks really happen a higher number in winters? Yes, it is a well-known fact all across the world that winter months bring along with them an increase in the heart attacks, also in the early morning hours. So why does this happen? We have to understand that in the early morning hours, there is a surge of sympathetic hormones. We have a circadian rhythm. Our body has a rhythm. The circadian rhythm. During the early morning hours, there's an increase in the hormones, epinephrine, norepinephrine, which are our sympathetic hormones, which we all need. So when these hormones come out of our body along with cold winter months, and it is your blood pressure is high, your heart rate is high, your heart is having to beat harder and stronger, there is increase in the clotting factors. Along with that, you have an upsurge of the hormones. It makes a perfect milieu in the early morning hours to have an increased incidence of heart attack. So it's important to understand that during winter, early morning hours puts our heart at vulnerability to have heart attacks. So we must pay every attention to anybody in our homes who tells you that I'm having chest discomfort, or I'm having something odd in my jaws, or I'm having pain on the inner side of my arms, or I'm feeling nauseous. Any of these symptoms which are outside of normal, one must pay due attention and go to the nearest hospital and have an ECG done.
Right, ma'am. Ma'am, the next question I would like to ask you is, what would you suggest to the heart patients to keep in mind in winters?
So, what should people who suffer from heart disease keep in mind during the winter months? So, with the onset of winter months, it's important that we tell our patients first they must dress appropriately. It's important to protect our bodies from cold. And how does one do that? By wearing layers. It's always better to wear layers because they trap the body heat, and you can always get rid of them layer by layer or wear them layer by layer. Second, during the winter months, there is also an increase in the incidence of heart attacks because people become physically inactive. It's important to remain active. During winter months, when you see the sunlight coming out during the day, it's a good idea to go out for a walk during the sunlight hours. You must stay physically active. You must make sure that you are well hydrated. Not drinking ample amounts of fluids can also put you at risk of certain diseases, also heart troubles. Those of you who have hypertension or diabetes must make sure that your blood pressure is well under control. As I just told you, make sure that your blood pressure is well taken care of. It is a known fact that smokers smoke more during the winter months. So we must tell our family members who are smokers that they must not smoke, because having high blood pressure, uncontrolled blood sugar, increase in the smoking, all of this puts you at further risk. Must make sure of what you eat. You must eat a healthy, balanced diet. Those of you who consume large amounts of salt must remember in winter your blood pressure tends to increase, as I just mentioned. Adding salt on top of that can be disastrous. Make sure you limit the intake of sugar. In India, we have this activity wherein during the winter months we increase the content of jaggery. Diabetics feel that they have this impression that jaggery is safe. No, It also causes an increase in your blood sugar. So you must make sure that you eat healthy, you drink carefully, the amount of water should be good. Those of you who consume alcohol must limit the quantum of alcohol that you take. During the winter months, there is an increase in the alcohol consumption, which also should be contained. Measure your risks. It is important to safeguard yourself rather than live in a blind world. One must check what's my blood pressure, what is my heart rate, what is my blood sugar, am I taking my medications regularly, do I need to seek a medical advice? After you've done all of this, those of you who have heart disease must further look back. Have I taken the flu shot? It is well known today that we want to safeguard ourselves from influenza. We have the influenza vaccine, which is very distinct from COVID vaccine. The influenza vaccine has to be taken every winter month for those of you who have heart disease or have comorbidities. There is a new virus which comes out during the winter for influenza. Hence, we have new vaccine which comes out around the month of October and November. It's important that you take your flu shot every winter. Last and most important as to what is it that is to be done for heart vulnerable patients, look back. Have you taken the COVID vaccine? You must ensure that you, your loved ones, the people around you, the people working with you, people working for you, all should have received the 2 doses of COVID vaccine. Well, as far as the booster is concerned, yes, there is a lot of dialogue, lot of debate. Having said that, when it comes out, you must follow what the policies are. It's a good idea. If it's available, you should go in for a booster. So I think dress appropriately in winters, stay active, reduce your comorbidity status, eat healthy, reduce salt and sugar, measure your risks, quit smoking if you can, reduce the amount of alcohol, take your flu shot if you haven't taken it. Make sure you, your loved ones, and the people around you are vaccinated to safeguard yourself from the coronavirus. So I think if you do all of this, this is the best we can do together to protect ourselves and our heart this winter.
Thank you so much, ma'am. It was very much informative. Ma'am, as you have explained it well that we should not take much salt and sugar in winters. So would you like to recommend specific diet that we should take in winters?
Yeah, so what are the dietary changes that one can do in winter? Well, I think to all of my patients who walk into my clinic, I tell them winter is a month where we must increase our intake of spinach. Winter is a month which gives us the opportunity to have green leafy vegetables. So unless they are contraindicated, which a small population of patients may not be able to consume, all of us must increase the consumption of green leafy vegetables. Our diet must contain a lot of carrots, bell peppers, lemon, oranges, because these are the best things that you can do for yourself, and have fresh fruits and vegetables. As far as dry fruit is concerned, it's a good idea to consume walnuts and almonds. They are the safest dry fruits for us to increase our good cholesterol, HDL, and keep our bad cholesterol under control. You must consume cashews, pistachios in control. They should not go overboard because they increase your bad cholesterol. So I think these are certain pointers as far as your diet is concerned. And of course, limit the consumption of alcohol, limit your consumption of salt and sugar. Along with this is the best we can do for ourselves.
Right, ma'am. The next question I would like to ask you is how exercise can help you boost heart health?
How does exercise help boost heart health? Well, I think exercise is one thing which helps boost our longevity, not just our heart health. Exercise is something which takes care of our heart, it takes care of our mind, it takes care of our entire vascular system. So one must strive to take out at least 30 to 40 minutes every day for oneself to go out in the sunlight and to go for a nice brisk walk. What is a brisk walk? For those who are young, try to attempt to cover 4 kilometers in 40 to 45 minutes. That's called being a brisk walk. So you must attempt to do this at least 7 days a week. For some of my patients, I tell them exercise 9 days a week, means do it twice a day. So the more you exercise, your mental health, your heart health, your vascular health is going to get better.
Right, ma'am. Thank you. So, can you please tell us simple lifestyle modifications that is to be done to lower your heart disease risk?
Yeah, so if you were to ask what am I to do to lower my heart disease risk in general, well, I think it goes without saying, and we've been saying this over and over and over again, but it never hurts to listen again. One, when you wake up in the morning, make sure that with your tea, you do not have biscuits. I hope people from the biscuit manufacturers are not listening to this section, but biscuits is the worst thing you can do to yourself when you wake up and have them with your tea. Rather, have a few almonds with your tea. So that's as soon as you wake up. Make sure after you've woken up, go out, go for exercise. Once the weather gets better, go out for a brisk walk. Come back. Have a healthy breakfast, which those of you who consume eggs are best that you can do to yourself, minimizing the consumption of yolks. Have eggs for breakfast. They are the best source of unadulterated protein. One egg gives you as much as 6 to 8 grams. Remember, you need as much as your body weight, as many grams of protein in your diet. Have a good lunch and have a light dinner. In these, make sure you have fresh fruits and vegetables. Have a bowl of salad. I mean, there is no better time than winters to consume all of this. Limit your alcohol. Make sure you do not smoke. So if you do all these factors, I'm sure you can do this to make your heart healthy. I think somebody has asked as to what can I control my bad cholesterol and what diet is better for that. Again, brings back us to the same points. The best thing that you can do for your bad cholesterol to come down, good cholesterol to increase, exercise regularly. Consume certain amount of nuts. Nuts being almonds and walnuts. Limit the intake of pistachios and cashews. Make sure your alcohol consumption is less. Make sure you can include fresh fruits and vegetables in your diet. Make sure you have a good source of protein. I just told you, if I weigh 60 kgs, I should attempt to have 50 to 60 grams of protein every day. One egg gives 6 to 8 grams of protein. So have eggs in your diet. Those of you who are vegetarian, try to look for opportunities as soya can give you, good amount of chana food can give you. Make sure you have paneer, but it should not be with fat-rich milk. So do these factors which will help you increase your good cholesterol and reduce your bad cholesterol. Alongside, those of you who are non-vegetarian, try to consume more amount of fish. Limit your taking of red meat. Make sure that you exercise. Make sure you take lots of flax seeds. Those of you who enjoy peanuts, small amount of peanuts are good for you. But peanuts, cashews and pistachios can be consumed in limited amounts. So I think if you do these to your diet, you can make a sea of a difference this winter.
Thank you, ma'am. You have explained well about winters and the heart health. So at the end, would you like to help your viewers with the take-home message?
I think there are some questions we can take. Somebody's asked, what if we eat sunflower?
Yeah. So, ma'am, the question is, what if we eat sunflower, pumpkin, sesame seeds, etc.? Are they good?
Yes. So, putting it in perspective, when I say flax seeds, I'm trying to include these seeds. These seeds are very good for your health. In one way or the other, you should try to combine them. But most importantly is exercise regularly. Have something which has proven themselves beyond doubt is walnuts and almonds. Have flax seeds. You can certainly consume the seeds, the sunflower seeds. They will always be good for you, and the pumpkin seeds. But most importantly, do a mix of everything for a good health.
Thank you, ma'am. So, ma'am, we have many questions for you. But prior to that, I would like to tell you, many viewers are asking for your well-being here, and they're wishing you a happy new year. So the question is, please tell us how to increase immunity.
Yes, so how do you increase your immunity? Immunity is something that human body is so interesting, and it's an enigma rather. So all of us are born with good immunity rather. It was seen in the last COVID wave Why did the young succumb? Those people who had very good immunity had a very high immune response. So we know that immunity is something which we all desire. Rarely it can be counterproductive, but we all must strive to have good immunity. How does one do that? The best remedy for good immunity is exercise. One must exercise regularly. One must eat a healthy diet. One must make sure that you get yourself tested, and if you have comorbidities, bring them at bay. If you have a high blood pressure, if you have diabetes, look after them. If you are a smoker, you must stop smoking. You must curtail it because it is going to dampen your immunity. Consumption of alcohol should be contained. You must have good foods in your diet. A very good diet helps you increase your immunity. Fresh fruits and vegetables, eggs, as I have been repeatedly saying, fish, chicken for vegetarian people, having paneer, having soya, have good proteins. All of this adds to your increased immunity. Do not fall back on having pills. Pills are not going to increase your immunity. They may be supportive, but the real factors are the facts that I mentioned.
Thank you, ma'am. I hope, Mr. Sudarshan, you have got your answer. So, the next question to you is, does winter cause chest pain?
Yes. So does winter cause chest pain? Well, those of us who are vulnerable to chest pain, it is called angina, that is the chest pain arising from the heart. Winter can exacerbate that. What is chest pain from the heart? Is a pain which is in the center of the chest. It is constrictive. It feels as if somebody is sitting on our chest wall, as if somebody has tied a band around our chest wall, and classically it comes when we walk and it stops when we rest. That is the chest pain arising from the heart. Winters can increase this chest pain, which is called angina, by virtue of causing constriction of our blood vessels. So you should remember that winters can increase the chest pain for those who are vulnerable to heart disease. Winter is a time we must stay protected.
Thank you, ma'am. Thank you, Mr. Piyush, for asking this question. And ma'am, you have answered the question of Mr. Saroj. The next question to you is from Mr. Shivam, who is asking what are the warning signs or symptoms of heart attack and stroke?
Yeah, I think that's a splendid question. What are the warning signs of a heart attack? If any one of us has risk factors like high blood pressure, diabetes, or we smoke or have high cholesterol, and when you go for your morning walk, you feel that you are unable to walk because you feel somebody has kept a weight on your chest. In women, it can be different. They may feel dyspnea, they may feel breathlessness, or if you feel that you have some pain around the inner side of your arm on your walking, or if you feel radiation of pain along your jaw, these are the factors which are warning signs. These are warning signs which one must not neglect. For a heart attack, the warning signs for a brain stroke are at any point in time, if you think that your relative or you have a confusional state or are not in the now, even for a few seconds, it's a good time that you seek medical advice.
Right, ma'am. Thank you. So we have another question which has already been answered in the session. So next question is, what can I do to lower my risk of heart disease?
I think I have been harping about this, but yes, if you wish to lower your heart disease, you must make sure that you quit smoking if you smoke, take alcohol in less amounts if you consume, take a healthy balanced diet, make time, at least some time for yourself to go out and exercise. I mentioned to you the protocol. You should try and cover in 40 minutes, you should try and cover 3.5 to 4 kilometers. That's called brisk walking for the young. And of course, keep yourself well protected in winters. Have a healthy, balanced diet. You do all of this, you'll keep yourself protected in winter.
Right, ma'am. The next question in the comment section is a heart failure a normal consequence of getting old?
Heart failure is, I would not say a normal consequence of getting old, but yes, as we age, the incidence of heart failure increases. We all can make an effort to keep ourselves protected from heart failure so that we don't suffer from heart failure as we get older. How does one do that? Simple. You must make sure that your blood pressure stays well. your blood sugar stays well controlled, you keep yourself protected from heart disease. If you do have heart disease, you have it tended to, you visit your doctor regularly, seek medical attention and follow medical advice. So I think these are certain pointers which you can make an effort to keep heart failure at bay.
I think, ma'am, your viewers are not letting you go soon today. So we have another question for you. What should be the ideal blood pressure?
The ideal blood pressure for adults should be less than 130 by 80 millimeters of mercury. This is a very good point and I wish to talk about here. Most of us live in denial. One, we don't check our blood pressures. If we check our blood pressure and find it to be higher, we live in denial that no, I cannot get high blood pressure. Let's understand, as we all get older in our lives, blood pressure, having a higher blood pressure is a consequence of aging. If we wish to not develop high blood pressure, it's important that when you are young and you're in your middle age, you exercise well, you limit what you eat, take less salt and exercise regularly. These are certain pointers which you can do. But if you have high blood pressure, do not live in denial. Get that treated, take a pill and you will be well.
Thank you, ma'am. So in the comment section, there is Ms. Rajni, Mr. Sudarshan Kumar, Mr. Saroj, who are thanking you for giving such a valuable advice and recommendations for good immunity. That's all the questions we have in the comment section. And would you like to tell something to our viewers?
Yes. So I think thank you so much for joining in. And the message I would leave you with is just what we started with. COVID is around. Please make sure that you're well protected. We are seeing a sudden change in the hospitals. Although this wave is milder and we believe and wish it continues to remain so, but we are seeing a sudden upsurge of people walking into our clinics, into our emergency rooms, and the number of people becoming positive is very large. So please stay safe, stay home. If you go out, stay masked well. Wish you all the best and wish you a very happy 2022. Goodbye.